Well, I think there's a couple of options. I mean, one is I really, really, really would like to see MDA bring back their care representatives to the clinic. I think that bringing back the loaner closets and bringing back a lot of the other resources that the MDA personally provided to patients, I think would go a long way. I think that as far as care from us clinicians, I think that also maybe inviting more allied health and other specialists to the MDA conference would be helpful in getting them to appreciate. I mean, so many of our heart failure cardiologists are involved with our dystrophy patients as they're living longer and longer. And it used to be a pediatric thing, and I think now, you know, trying to get the advocacy out that, hey, adult cardiology, you need to know about this too. Yep. So, and then especially in the, you know, now with all the gene therapy we have, you know, having more of a genetics presence in clinic. I mean, we've been blessed at Vanderbilt with having a huge genetics program, but we actually haven't had them come over reliably to clinic. And so I think that having better availability, and that might be an advocacy step, is to provide more genetic testing. Like, so, I mean, MDA did a great program where they were offering free testing through Baylor for neuromuscular, like, dystrophy, you know, mutation analysis, but expanding that to, like, all Charcot-Marie-Tooth, all, you know, all the disorders, because the problem is you can't find a cure if you don't know what the gene is. And you can't identify the patients who are available, you know, who should get that treatment if they don't know what gene they have. You know, and it's a big shift in thinking. I mean, Jerry Fenichel used to tell patients, well, it doesn't matter because we don't have anything for it anyway. No. And shifting that thinking to saying, no, it actually does matter that we know what gene you have. So that way, you know, we might not have a treatment like today, but down the road we might. Well, and then you have all the fun stuff that comes with genetic testing. So, you know, that's why I think having more availability of genetic counselors in clinic to talk, you know, to be able to talk to some of those things, and also just different avenues for patients. Like, for example, I had a CMT patient who had very bad CMT. It ran in his family. His dad had it, excuse me, and he and his wife chose to adopt an embryo, which I didn't even know was a thing. But it was a great idea because then his wife could be pregnant, and it was an open adoption, so their kid will eventually know who their genetic family is. But then he didn't have any of the stress of worrying about whether or not, you know, taking that 50-50 chance of whether or not he was going to pass this neuropathy on to his kids. And I was like, this is a phenomenal idea. And I was like, okay, you guys need to talk about this. I mean, my colleague, Dr. Desai, is going to talk more about the pediatric side, but I think one of the things that we need to do a better job on that they touched at the Care Center conference is transitional care. And because for a lot of young adults, when they make that leap to adulthood, one, the biggest challenge is the drop-off in insurance. That is probably the biggest challenge we face. Because a lot of states, like mine, have better coverage for kids with disabilities, and then when they become adults, that coverage drops off, you know, as far as care in the home, et cetera. And then also just being able to talk about college, like where are you going to go to school? How are you going to get a degree? Like vocational training, like, you know, being able to make job opportunities possible. I think that is also something that we discuss in, you know, with our younger patients, as opposed to older patients where you're talking about, you know, do you have a handicap? You know, is your home, like, have you prepared, you know, do you have resources for, like, do you need to go in assisted living? You know, do you have enough family members around? I mean, all those types of issues.